Maya is 8 and has eczema, also called atopic dermatitis, and hay fever, also called allergic rhinitis. Intense itching, irritated skin, sneezing, and a runny nose can disrupt her sleep, school, and daily life. James is 56 and has asthma and chronic rhinosinusitis with nasal polyps. He's often short of breath, wheezes, feels stuffed up, and has lost his sense of smell. Although their symptoms and conditions are different, they may share an underlying cause. Maya and James may be experiencing type 2 inflammation, an immune response linked to several allergic conditions, including eczema, asthma, hay fever, food allergies, eosinophilic esophagitis, or EOE, chronic rhinosinusitis with nasal polyps, and eosinophilic chronic obstructive pulmonary disease, or COPD. With type 2 inflammation, the immune system overreacts. This can lead to excess inflammation that affects different parts of the body, including the skin, upper and lower airways, nose, sinuses, and GI tract. These conditions do not always appear at the same time. They can develop at different points in life, sometimes in a progression known as the atopic or allergic march. Maya has eczema and hay fever, but may later develop asthma or EOE. James developed asthma as a teen and nasal polyps as an adult. Every patient is different, and not all will develop other conditions. While many of these conditions are driven by type 2 inflammation, not all forms are. That's why it's important to look at each patient's symptoms and history. When type 2 inflammation is involved, patients may notice symptoms affecting more than one part of the body, such as a runny nose, sneezing, itchy skin, wheezing, coughing, or trouble swallowing. Recognizing these patterns can help patients and doctors better understand what may be happening. Board-certified allergists are trained to recognize patterns across these conditions and have the expertise to treat them all. Allergists use a patient's history, symptoms, allergy tests, and other lab work to determine if type 2 inflammation may be contributing. This information helps guide treatment. Allergists also work with the patient's primary care doctor to coordinate care. Patients may use inhalers, nasal sprays, topical medicines, or other treatments to help manage their condition. Some may also benefit from biologic medicines, which target specific parts of the inflammatory pathway and may help treat more than one condition. With the right care plan, patients can take meaningful steps toward feeling better. Maya's family is better prepared to manage her symptoms and make her more comfortable. James is breathing more easily and has few disruptions from his symptoms with a treatment approach that works for him. Understanding type 2 inflammation can help connect the dots. If you or a family member has any of these symptoms or conditions, adding an allergist to your care team can help determine whether type 2 inflammation may be playing a role and guide you to the right treatment options.